I'm going to talk a little bit about farm workers and some of the issues that you have to think about when you're trying to train students, medical students, to have to provide health care, just train doctors in general to provide health care. So the first thing we have to understand is that there's somewhere between 1 million and 2 million farm workers in this country, maybe more, maybe less. Although things like the Census of Agriculture will tell me how many pigs were farrowed last year, they won't tell me how many people work on farms. It's just not counted. The closest estimate is actually out of USDA. A guy named Candle a few years ago estimated 1.2 million. It's probably a pretty good estimate. Most of these farm workers are Latino, not all of them. About 90% and about 80% are born in Mexico. But when we say Latino, you have to understand that 20 to 25% are indigenous peoples, and that makes a difference. They're generally unaccompanied men, but not always. There are families that still migrate, and seasonal families. And the latest estimate out of the National Agricultural Workers Survey, sometimes referred to as the NAWS, says 20 to 30% of the workforce is female, which raises a number of questions about sexual abuse in the fields, which is starting to be better addressed. I will say farm workers are vulnerable because they're Latino, and because they could be sitting at home and ICE can pull up and they could be gone. That happens, and their kids could be here because most of their kids end up being born in the United States and they're citizens. But not only are they undocumented, at least half of them according to the NAWS, but they have limited English language skills, limited formal education, and low income. Remember, farm work is seasonal, it's temporary, and usually you get paid minimum wage, and as we'll see in a minute, you don't get paid overtime for doing farm work. It's all straight time. So that's part of farm work. At the same time, we have to understand that farm workers are a diverse group. So we start with the definition seasonal, someone who's working full-time, making their major income doing farm work for part of the year. That's a seasonal farm worker. A migrant farm worker is someone who moves 75 miles, changes their residence at least 75 miles to do that seasonal work. They can be point to point, they can be follow the crop, but that's it. Most farm workers or the classic picture of a farm worker is someone who's picking heads of lettuce or tobacco or what have you. But a growing number of immigrant farm workers who are more permanent are working with animals now. And that's something to take into consideration. And the literature on dairy workers, most of the dairy workers now are Latinos, because dairy work is a 24/7, 365-day business, and white folks don't want to do that. Okay? So it's Latinos doing that. Documentation, I've already said, about half of farm workers are undocumented. There's a growing number in this whole idea of H-2A visa workers. H-2A is a temporary worker visa. There are, now I'm going to go out on a limb, 60,000 of them, about a quarter of them work in North Carolina. North Carolina has more H-2A workers than any other state. It's the new Groceros program, and they're talking about expanding it. And Southern Poverty Law Center did a report on workers with H-2A visas entitled it Close to Slavery, so you can have some idea of what the working conditions are. There is regional variation. Not all farm work is the same. Crops differ. This gentleman here is spraying glyphosate at quarter strength to keep the weeds down around Christmas trees in western North Carolina. You may not grow many Christmas trees in Tennessee, but you do grow a bunch of tomatoes up in the mountains. Housing varies state to state and within states. So workers in eastern North Carolina live in camps. Migrant workers called camps, grower-provided housing. In the west, they don't. In California, growers stopped providing houses, so there's a lot of homeless farm workers in California, whereas in Oregon and Washington, grower housing is still there. State laws vary. What is allowable varies by state to state, including what age you can be when you're doing farm work and housing conditions. As I already mentioned, H-2A visas are variable state to state. North Carolina has a lot. And language. Remember those 20 to 25% indigenous workers? Their first language isn't Spanish. It's Quiche, or Mam, or Trique, or 20 other languages from southern Mexico and Guatemala and Central America. Agriculture is dangerous. It's one of the most dangerous jobs in the country. You're exposed to weather, machinery, chemicals, domesticated animals, wild animals. You're exposed to things like those beautiful tobacco plants. Aren't they beautiful plants? I've always loved tobacco plants, from which you can absorb nicotine and get poison called green tobacco sickness. At the same time, while agriculture is one of the most dangerous industries, and farm work is one of the most dangerous jobs in this country, there are few regulations that apply to agriculture. It seems that back in the 1930s, when FDR was trying to get labor laws passed, he made a deal with Southern legislators who didn't want these laws to apply to their sharecroppers. You could say, well, that was the 1930s, but you have to understand we passed the OSHA regs law in the early 70s, and by 78, Congress had restricted the use of federal funds to enforce OSHA regs on farms. And many of those still don't work. Child labor. According to the federal standards, you can be 10 years old and be employed as a farm worker. You do need parental permission. By the time you're 14, you don't need parental permission anymore, but you don't need a work permit. And you can be picking tobacco that has been sprayed with toxic chemicals, and that's okay. I know this because we're currently doing a study on those issues. When you think about farm workers, it's not just occupational exposure. Farm work is occupational, you think of occupational exposures, there's also power occupational exposure. So if you live next to a farm field, where most farm workers live, you're gonna get chemical drift coming in. You're gonna take chemicals home with you on your clothes, and you're gonna expose your family. You also, because you're poor, if your housing in your neighborhood tend to be in pretty bad shape, and you're exposed to many things that way. So you have to pay attention to that when you're providing health care. Health issues, well, there's lots of health issues. If you're a farm worker, you have lots of musculoskeletal disorders because you're stooping and working in awkward positions and picking up heavy loads, throwing baskets of tomatoes up to trucks and catching those baskets. You're exposed to chemicals, as I said, nicotine, but also pesticides and fertilizers and petroleum products. There's high rates of chronic conditions among farm workers, diabetes and heart disease being two. Also high levels of infectious disease. Many farm workers come from Mexico where there's still a lot of TB. I've been around farm worker camps a lot. I have latent TB from doing that, but there's also high levels of STIs, because if you've got large groups of guys and you separate them from their families for 6 months of the year, STDs happen, HIV happens, and men have sex with men. All of the issues that we have to pay attention to. High levels of mental health. We've measured anxiety, stress, depression, and alcohol abuse, all high levels within the farm worker population, very high. And then child development. We're talking about adverse childhood experiences, but not only do you have adverse childhood experiences, they're living in old housing with lead. More important, and as important as that, they're living and being exposed to organophosphorus pesticides, which we have shown now. We have the data that will lower your IQ from exposure. So we have those health issues to deal with. Then they have limited access to health care. So they seldom have health insurance. It's not necessary to, if you have temporary workers, to provide them. If you have an H-2A visa, you're supposed to have access to ACA. Okay, that's good. In many states, employers do not have to provide workers' compensation. So if you're injured, you're on your own, and there's no paid sick leave. Now again, these are contingent workers. If you don't show up to work, you don't get paid. And if clinics are only open 8 to 5, when you're supposed to be picking crops. Now luckily there are some people doing things about that issue. They were probably about 16, but their father said they were 18. Anyway, so healthcare access is, again, varies state to state, so you have to be aware of that. There are migrant clinics. North Carolina actually does a good job of this. We have about 18 migrant clinics to serve 150,000 farm workers. Some of them are actually open 5 days a week. Some only provide care to farm workers 2 evenings a week. And most of them have outreach programs, which is really good. There are some national programs that we have to pay attention to that HRSA has funded. They're central grantees. These are organizations, nonprofits, that provide support to migrant and rural clinics to provide health care with Farm Worker Justice, Farm Worker Health Services, Migrant Clinicians Network, etc. I work with several of these, and they provide us with some support. Innovation and training. Within farm workers, what we've seen is lay health advisors, lay health outreach is really beneficial. It does a good job. There's more mobile clinics going out, and that's also useful in worker centers. CME courses abound. Migrant Clinicians Network, I think every week I hear about a new CME course through them. I've done CME courses. We really need this because most of the physicians providing care to farm workers or at rural clinics, they do their 3 years and they're off. And so you have to continually retrain them, and most physicians don't get any occupational health, less this other stuff, which is why we're doing this. So when we talk about training, we, again, culturally appropriate, okay, fine. It has to address not only occupational but para-occupational exposures of children and adults. It needs to be hands-on, and I think we really do need to emphasize the mental health aspects of this. So with that, thank you.